If the delegating nurse did not complete the assessment for medications, nutrition, fluids per GJ tube for the person, the nurse should review the assessment prior to delegation to ensure the nurse is not delegating more supports than is needed. The assessment for insulin metabolic glycemic disorder medications must be completed by a licensed nurse. If the nurse does not know the person well, then it is recommended that a second observer who does and who is also familiar with the person's mode of communication be present to ensure the results are indicative of the person's capacity to safely administer the medication. If the delegating nurse did not complete the assessment for insulin metabolic glycemic disorder medications for the person, the nurse should review the assessment prior to delegation to ensure the nurse is not delegating more supports than is needed. Important considerations. People have an inherent right to self-administer. The assessment form is used to prove the need to override that right. The person being assessed may not be able to state medical terminology, but relaying content intent in their own words or phrases is enough. The person may not be able to state specific side effects, but the ability to report health issues is how potential side effects will be recognized by prescriber healthcare professional family caregiver. People with IDD have the right to do as many steps of self-administration as they can do, either independently or with support, even if they are not assessed to be able to self-administer with or without assistance. Support providers must be legally qualified for whatever support they provide. The team must follow the appropriate processes associated with rights restrictions if a person has been assessed as having the knowledge and skill to self-administer, but has demonstrated unsafe behaviors and is therefore not able to self-administer. Multiple self-administration assessments may be needed for a person if their knowledge and skills vary with different medications treatment circumstances. Separate self-administration assessment forms should be used to document variable abilities with different medications treatments and circumstances. For example, if a person is not able to self-administer multiple medications at 8 a.m., but can self-administer one or more medications at 12 p.m., or can apply their topical medications independently, then different assessments should be completed to confirm the different outcomes. If two people do not agree with the assessment based on safety concerns, a third team member should be consulted. Complete the specific self-administration assessment form as designed for oral and topical medications, inhaled medications, oxygen administration, health-related activities such as obtaining temperature or blood pressure, glucometer, medications, nutrition, fluids per GJ tube, insulin metabolic glycemic disorder medications. The form is a basic assessment tool. If the outcome on this form is unable to self-administer with or without assistance, the team needs to assess in more detail to determine what steps of medication administration the person can do, and plan only to provide the necessary support for other steps. Using the form. The assessment is the first part of the form, followed by the assessment outcome. A. Answer every assessment question on the form. Questions are answered with a yes, no, or NA. B. Document the outcome of the assessment. One of the three possible outcomes will be determined based on the assessment. 1. Able to self-administer. 2. Able to self-administer with assistance. 3. Unable to self-administer with or without assistance. Other mitigating factors are then addressed in the Other Considerations section of page 2 regarding the assessment outcome. Processing the assessment results. Once the assessment is completed, the ISP should specify how medications, treatments, health-related activities will be completed. The ISP will state one of the three possible outcome results. Able to self-administer without assistance. able to self-administer with assistance, or unable to self-administer with or without assistance. If the outcome is able to self-administer with assistance, the ISP should clearly identify which of the three types of assistance is needed and who will provide that assistance. If the outcome is unable to self-administer with or without assistance, the ISP should clearly identify what steps of medication treatments, health-related activities the person can do, and who will provide the other steps of the medication administration process. The SSA KIT shall ensure the results of the self-administration assessment appear in the ISP. The current Department of Developmental Disabilities approved assessment forms are on the Department of Developmental Disabilities website.